Hello, everyone, and welcome to Talk with a Doc, a new thought leadership series brought to you by HealthSnap, where we hear from the nation's leading healthcare experts on their perspective of technology's role in patient care post-COVID-19. My name is Samson Magid, and I'm the co-founder and CEO of HealthSnap. Joining me today, we have Dr. Abraham, a board-certified internal medicine physician with a focus on geriatric and adult medicine at Annapolis Internal Medicine in Annapolis, Maryland. Dr. Abraham, thank you so much for your time today. We appreciate you joining us.
Yes, thank you for having me.
So I thought we'd start off with just a quick introduction to yourself, to your organization, and then also you can share a little bit more about maybe your career path, how you got to where you are today, and how you're thinking about it in the future as well.
Yes, so my name is Dr. Titus Abraham. I'm an internist, as you said, in Annapolis. I am the managing physician also of a practice located in Annapolis. Most of our practice, a large part of our practice has a geriatric population, Medicare patients, and the commercial side also. I did not begin in this practice in my career. I actually started as a hospitalist some 20 years ago and was in that role for about maybe 8 years and decided that I wanted to try something different. I joined the practice I'm currently in. I've been here about going on 13 years now. So I have a full practice. I see lots of patients and enjoy every minute of it. And also I'm the managing physician, try to help guide the practice through strategic changes and all the shifts we've seen in the past year. So that's sort of my role here in Annapolis at this practice.
Got it. That sounds great. So you mentioned this past year. We all know that I think COVID-19 has really changed healthcare in the United States and everyone's viewpoint on how it can be delivered in different ways, whether it's through technology or thinking about meeting patients where they're at in their home. And that brings us to the topic that we want to talk mainly about today, which is virtual care. People have been talking about virtual care adoption over the last year, especially, and looking at, is it here to stay? Is this something that is just a result of COVID-19, or is this a long-term change in healthcare delivery in the United States? And when I say virtual care, there's a lot of different words to describe that, but I'd love to hear your perspectives on one, if you feel virtual care is here to stay. Two, how Annapolis has changed maybe your patient strategy over the last year, whether that's adoption of telehealth, remote patient monitoring, or any virtual care solutions that you've done, and how you are thinking about that in the future as a practicing physician, as you think about managing patients with chronic conditions specifically.
Sure. So as a brief background, I've been doing telemedicine, that is interacting with patients via video, for at least 5 years. So my experience with telehealth predates COVID substantially. I think the way I look at COVID is that it's an accelerant. So it speeds up eventual trends. And it is sort of creates a disruption in a normal pattern of care. So when I look back to March 2020 as being the defining moment, the inflection point, if you will, I look at it as an event where we were faced with circumstances of practice and as a country. Well, what do you do now? We're telling patients they can't go to the doctor's office, they can't seek care they normally do, under the normal circumstances. So it comes down to technology and it comes down to reimbursement, frankly. So most here in Maryland, we have a parity law with telehealth. So the commercial payers basically pay for telehealth at the same rates that they pay for in-office visit. So for me, to me, adopting telehealth was advantageous for the patients and the practice. I could take care of patients virtually the same manner almost, except I can't physically examine them. But I can take care of a lot by just with telehealth on the commercial side. Medicare, not so much. Medicare was really holdout on this. But since March 2020, Medicare has actually, I think, taken the lead on this. They really sort of threw out the old playbook, if you will, and faced with an existential crisis, I think. And I'm not exaggerating. I think primary care, a lot of healthcare systems were facing an existential crisis because essentially, you get reimbursed for care you deliver in person. And if you have a primary care practice, or even most practices where you're doing any sort of procedure or any sort of thing in office, unless you're able to interact with the patient, you cannot care for that patient and you cannot get reimbursed. So it's a double whammy on all fronts. So healthcare was facing an existential crisis here. So Medicare came through. They changed the regulations under the healthcare emergency, and they said, look, we'll pay you, we'll reimburse you. You just got to figure out how to do it safely and properly. Follow the rules. And what we did in Annapolis Internal Medicine, because of my experience with it, I looked at it as an opportunity. I said, hey, here's a chance. Never let a crisis go to waste. And so I basically said, look, we've got to do this. And some of my partners who had sort of been hesitant to get on board were running on board. They couldn't get on fast enough. And ironically, of course, the problem we faced was the opposite. So the platforms that we took for granted, that I took for granted, suddenly were overwhelmed by demand from all over the country. And so, but we managed, we figured we were able to develop backup systems, backup platforms. And then the next challenge, besides the providers and the clinicians buying into it, is really getting patients used to the idea. Of course, Medicare, most of the patients are over 65, so how do you, patients who are not really invested in this idea of telehealth, how do you get them on board? And so we really did on a ground level campaign, getting patients onto our portal, trying to really streamline the process, getting them on a platform, not making it difficult. Medicare made it easier in the sense that they sort of relaxed the HIPAA regulations. So if someone had a FaceTime or some sort of Zoom functionality, they could use that, because a lot of the platform we had is easy to use, I think, but may have posed a challenge to some of our patients. So you look at all that in combination, I think COVID really accelerated dramatically by at least, I think, a decade, the adoption of telehealth. As far as where it's going, I think you're certainly going to see back in-office care. I think we've already done that here in our practice. But I, as a practitioner, I'm hesitant to give it up in any fashion. I want to maintain as a significant portion of our practice, because I think it belongs in the future of healthcare and value-based medicine. And I think it really does play an important role in value-based medicine.
Yeah, that's great to hear. And I'm curious if we can unpack a little bit on the Medicare side of the patient's perspective. How do you feel their experience has been? Do you feel like they've been receptive to it as you work through some of the initial kinks here? Do they feel like they're getting the access to care that they're looking for and the actual right care they're looking for? Or are they looking for more? What are your thoughts on that? What has the patient feedback been so far?
Yeah, I think overwhelmingly patients have been very positive about it. I think once they've had the experience, they realize a lot can be done via virtual modalities. And I think the overall experience has been very positive. I don't think that patients will view telehealth any differently now. I think it is superior in some ways to in-office care. There are certainly some patients who really still want to do that in-office visit for their visits. And you know what? I think there's always going to be a role for in-office face-to-face care. I think that's not going to go away by any stretch. I think you need to establish, especially in primary care, where it's such a longitudinal type of care, where you're creating relationships over time built on trust. You can't really always do that just by telehealth. There has to be some face-to-face care that'll happen. But I would say that a significant portion of the care can still be delivered over telehealth, and the patients have really taken to it from all strata, age groups, and things like that. And if the patients can, family members can, and they really help their seniors get on board.
Yeah, absolutely. I definitely am starting to hear more of most providers I talked to about this are landing on that hybrid approach, right? It's not going to be all virtual or all in person, but there's going to be a happy medium. That's a hybrid approach based on the patient care, and you're absolutely right longitudinally how you adjust that care over time with in office and virtual first. You brought up an interesting topic that I'd love to transition into a little bit is value-based care and using technology to help elicit and scale value-based care, which is a buzzword, I'll say, but everyone has their own definition on it. So I know I've heard phrases like value over volume and prevention over treatment, or population health driven and data driven. So I'd love to hear what value-based care, number one, means to you. And then number two, what are your perspectives on adoption of value-based care or outcomes-based patient care, and what are some of the challenges that the industry needs to work through from a practicing physician's perspective to make it more widespread?
Sure. So I think when I think of value-based care is that it really comes down largely to payment. How do we pay the clinicians for their work, for their procedural work, for their cognitive work? And how do we ensure outcomes for patients? How do we ensure that patients don't end up in the emergency room, don't end up in the hospital, that we're meeting goals for blood pressure, for diabetes? The way I look at value-based care, it's more about achieving certain outcomes and really improving the patient experience with healthcare. We for a long time have taken for granted that patients should sit in a waiting room for 30 minutes or even longer to see their doctor. I think that in value-based care and with the enablement of technology, that really is that is going to go the way of the dinosaur. That really is not acceptable anymore. So value-based care takes all to that into account. And so in the end, how do you deliver that in a package that makes sense to providers? I think the challenge that payers are facing is that facilities and physicians largely still are paid on a per diem basis, episodic care, if you will, a transactional mode of care. I see a patient, I get paid to see the patient. So when I look at value-based contracts, often that's what they're still telling me. I tell them, look, you're still paying me fee for service. And if we're going to do value-based care, we have to rethink that model. We need to pay the doctors and the providers and the clinicians for their work at that time, at that transaction. I am certain that's not going to go away either. But how do we say, well, you're responsible now to some extent for the outcomes of all these other patients that you're not seeing? So that really puts care, I think, on two tracks. So I have my patient panel I see every day. I take care of the patients. We talk, we discuss their care, we adjust medications, order lab tests, do all the stuff that we normally do in that sort of transactional episodic mode. But then I have employees, I have staff looking at our population saying, well, Mrs. Jones' blood pressure was high last time and she's not got any sort of intervention planned. So what do we do? Maybe she missed her visit, or she can arrange a telehealth visit, or maybe we can set up some modality or RPM or something to manage that care. So I'm not necessarily aware of that because that's happening in the background, but somebody's looking at that list, that population of patients, seeing who went to the emergency room, who went there, and then trying to connect those two worlds. Because eventually I'm going to get involved at some level. But if I'm always focused on that transactional type care, that episodic care, I'm never going to be able to help manage the care of that patient who's not there, who for some reason is not able to get better care or meet their diabetes goals or meet their blood pressure goals. So value-based care really looks at care beyond that transaction, that episodic care, if you will.
Got it. I think that's super powerful, and really starting at the population level, right? The incentives at the population need to align with the care that's delivered at the population. And that all makes perfect sense. I view it as really a chicken and the egg approach, right? Are the providers willing to take on that risk, and are the payers willing to put in network the providers that can actually deliver meaningful outcomes? But hopefully we can get there sooner than later, and the transition happens as a result of this past year at an accelerated pace, which I think we're starting to see now with different technologies in place. So it's exciting times for sure. With that, would love to hear your closing thoughts. How do you view technology's role in healthcare delivery? Are there certain conditions or use cases that you feel like are more privy to technology versus others? How do you view patient care being moved from the clinic to the home, and how technology plays a role in all of that for both your practice and I think industry at large as well?
Right. So I think technology is a wonderful tool. I think at the end of the day, it's all about the outcomes. Are the patients experiencing the outcomes, the care they expect to receive? Are we delivering as the healthcare system what we promised to deliver? And I think technology is a great tool to do that. Whether it's telehealth, so I'm meeting the patient at their convenience, not necessarily my convenience all the time. I'm meeting where they need to be met. I think that's critical. So that convenience aspect is important. They're not in my waiting room, necessarily being exposed to someone else who's got an infection or whatever. They're in their home. They're in the comfort of their home. They're where they need to be to interact with me. Um, you know, the aspect of telehealth lends itself to that. As far as role for other monitoring modalities, remote patient monitoring, I think is an excellent tool. Patients' blood pressure sometimes are high in the doctor's office. And so you can get a very false sense that this patient's blood pressure is not controlled well, or maybe the opposite. And so RPM allows for more longitudinal assessment of that patient's care. You know, are they doing well at home? And maybe this blood pressure reading was an anomaly. And so it gives a more realistic approach. And I don't always have to wait for them to be in my office to make a change. Hey, if that alert goes off, their blood pressure is high, it tracks me, keys me in, keys a staff member in to take a look, and then we can engage with the patient to make changes if we need to. I think all these are pieces of the puzzle that technology can deliver. As long as we keep our eyes on the outcomes, the goals that we're trying to achieve, that we need to sort of relook at this model of care. It's continuous, it's longitudinal, it's not it's based on the patient's where they are in their life, and we're meeting them at their point of reference. I think that's where technology is going to take us. I think home-based care, whether we're talking about testing, even lab testing, there's such a push now for COVID home testing. I think that's where it's going to go. I think all this stuff is moving towards that patient-centered approach, and I think it's good. I think it's excellent as long as we can ensure that the quality of care is there, that the testing, the monitoring is up to par, that we're not compromising those standards and confusing the picture in return.
Got it. Yeah, I love that. And yeah, it's a phrase we use here at HealthSnap all the time. It's how do you ensure that the right patient receives the right care at the right time? And providers like yourselves who are understanding that patient care needs to be, especially with chronic condition management, more ongoing, proactive, and delivered in the home is certainly where I think the entire industry is starting to move towards today and in the future. Well, that was all we have for today, Dr. Abraham. Thank you so much for your insights and perspective and your partnership as well. I appreciate your time and wishing you all the best, and hope to talk soon.
Well, thanks for having me. Good luck.
Thank you.